and other preventive testing and screenings that they would otherwise not have. It's been lost in much of the discussion about the Affordable Health Care Act, these preventive visits that people can get without a co-payment, without money coming out of their pockets, because the idea is that if you prevent illness, it's better than dealing with it after the fact. There are some people who say, well, senior citizens on Medicare would not benefit from the Affordable Health Care Act. That's not true. The fact of the matter, the most important thing that the Affordable Health Care Act has done for seniors is close the donut hole on prescription drugs. 6 million seniors have saved $6 billion in the last 2 years because of the Affordable Health Care Act. People would otherwise have to come out of pocket for those $6 billion to pay for their prescription drugs. What we want to do today, and what we will continue to do, is rise above the politics, the petty politics, the fact that Congress has taken 40 votes to undo the Affordable Health Care Act, wasted time knowing that it could not pass the Senate, it could not pass the president's veto pen. For them to waste the people's time with 40 votes to undo the Affordable Health Care Act is just, in this environment, criminal. Because in Georgia, even as we speak, there are 2 million people without health care. And I could not close without making a special mention of Medicaid expansion. We have called on the governor for the last year, and we will continue to demand that the governor sign on to Medicaid expansion. There are 2 million people in Georgia without health care. 2 million people. If the governor signed on to that 100% money, I'll repeat that, this is 100% money. If the governor signed on to it, 700,000 of those 2 million people would have health care. 1,000 people die every year per 1 million people without health care. 1,000 people die every year because they lack health care. We as lawmakers and as citizens and as advocates fight on these issues because we know that ultimately it is a matter of what? Life and death. So we call on the governor to do the right thing, not play petty politics, but do the right thing, expand Medicaid, add that to the benefits that Georgians will accrue from the Affordable Health Care Act. Thank you.
Thank you so much, Senator Fort, for your words and everything that you do for us on a daily basis in the Georgia legislature. Next up, we have a young lady with us who has been a Democratic political consultant for a number of years. She was also a staffer in the Clinton White House, and she is very passionate about Obamacare and all that it does for Americans. And so I want to bring up at this time Ms. Erica Long.
Thank you, Nikki. Thank all of you who've come out here today. There's probably no more important issue facing all of us than the implementation of the Affordable Care Act. And unfortunately, because it's just at the implementation stage, there are so many people who stand to benefit who are not yet engaged on what Obamacare means for them. Senator Ford is absolutely right. The U.S. Congress has voted time and time again, 40 times and counting, to repeal Obamacare. They've not been successful. The latest attempt is to defund Obamacare, to take all of the money that should be going out to the states, that should be going to community health centers and organizations, to take that out of the budget so that we won't benefit. And there is now currently a threat to shut down the federal government unless Obamacare is repealed. So this is the political landscape that we're operating under. Obamacare is the law of the land. It was passed by Congress. It was signed into law by the president. It's been upheld by the United States Supreme Court. But time and time again, there are political games being played on every level of government to take away from you your right to enjoy affordable health care, to make affordable health care available for yourselves and your family. Since this is a fairly young crowd out here today, we must talk about the benefits of Obamacare for people ages 18 through 26. You probably know that under Obamacare, you can stay under your parents' insurance until you're 26 years old. That gives you that much more flexibility and time to find that job, to get settled in your career, to find a traditional way of paying for your own health insurance. And when you think about women and young women, family planning concerns, all of the important roles, all the important decisions that young women have to make for their health and for family planning, because of Obamacare, because of the ability to have your preventive care doctor's visits, your well woman visits, your contraceptive coverage, all of that is available under this Affordable Care Act. So the question is, what do we do as informed consumers? What do we do? How do we reach out to our friends, our family members, our neighbors who don't have access to this information? Direct them to the White House website, to whitehouse.gov. Direct them to Enroll America, the affiliate arm of Obama for America that is going to go out and knock on the doors and get people information that they need for this upcoming October 1st deadline. And take it a step further and call your state insurance commissioner right around the corner here in Georgia, Republican Ralph Hudgens. Ralph Hudgens was elected to office to make sure that insurance rates are good for consumers of Georgia. And a part of his job is to help